From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Good evening, folks. This evening I want to talk a few minutes about Lyme disease. Lyme disease is very common, and it's basically a chronic disease caused by the spirochete Borrelia burgdorferi. And the transmission is by several tick vectors like Exodus, Amblyoma, Rhizocephalus. Those are the ticks. And the highest prevalence of Lyme disease is found in the northeast and midwest. There are 3 stages. In stage 1 we see the rash accompanied by fever. And when you treat these patients in stage 1, you can prevent many serious complications of this disease. So I see a lot of patients in my clinic with Lyme disease, and most of them come in stage 1, the erythema migrans. That is stage 1. Then there is stage 2, stage 3. And following the tick bite, the patient may not even notice it. And they gradually develop that redness with the clearing in the center. It's called bull's eye. They say it looks like a bull's eye. That's erythema migrans and a classic sign of Lyme disease. About half of the patients will develop smaller lesions of a similar morphology at areas remote from the bite site. So it's not just one single lesion of rash. In stage 1, erythema migrans, we also see fever, chills, malaise, and also regional lymphadenopathy around the bite size. And in stage 2, you see that the symptoms related to multi-system, because other system, the disease is spreading basically. Patient can develop meningitis and hepatitis, sore throat, dry cough, heart block, and other cardiac musculoskeletal pain, and also neuropathy when central nervous system is involved. So you see the stage 1, stage 2, and stage 3. And when there is a persistent illness, we say it is stage 3. It can happen from months to years and usually involves the musculoskeletal system, causing chronic arthritis and neurologic system problems, both the peripheral nervous system and central nervous system. And it can also affect the skin. It's called acrodermatitis chronica atrophicus. So remember that word, acrodermatitis chronica atrophicus is the stage 3 skin manifestation of Lyme disease. And the treatment of at any stage is important. And it can also affect other organs like eye. When the eye is involved, conjunctivitis is the most frequent problem we see in stage 1. And it can also cause cranial nerve palsies affecting the 7th nerve, causing the Bell's palsy. And other nerves can also, like 6th nerve, 3rd nerve, ophthalmic abnormalities can also happen. And it can also cause uveitis, ischemic neuropathy, optic disc edema, and also sometimes bilateral keratitis and choroiditis and exudative retinal detachments. So you see, eye can be affected, heart can be affected. And when the heart is affected, it can happen in up to 10% of patients. They develop conduction abnormalities or fluctuating degrees of AV block. So conduction abnormalities happens. Patients can develop a syncope due to complete heart block, and they might even require temporary transvenous pacing. So let me give you a case. A patient came to you with a bull's eye rash and he has syncope. What is the diagnosis? The diagnosis is Lyme disease. The patient got Lyme carditis. The syncope probably coming from AV block. You see how important the symptoms are in diagnosing these patients. But the good news is the course of the disease is usually benign and complete recovery is the role. Now what about the labs? When you do the laboratory testing, they are not reliable or standardized. The diagnosis is clinical. You see that pathognomonic rash, a history of tick bite, and what are the symptoms the patient is having. Based on those things, you make the diagnosis. And when the probability is low, like when you see just some muscle aches and fatigue, and there is no rash and you're just confused, then you can do some ELISA testing for immunoglobulins. So if you do the labs in these patients, they can have an elevated SGOT and SGPT, the liver enzymes, because you remember, as I said, Lyme disease can affect the liver, causing hepatitis. Now let me talk a few minutes about the treatment. The first line of treatment is tetracyclines for at least 10 days if symptoms are minimal, or 10 to 20 days if the symptoms are more complex. So tetracyclines for at least 10 days. What about children in whom you cannot use tetracycline? If the patient is like less than 12, you should use amoxicillin or penicillin vial. What about if the patient is allergic to penicillin? Then you should use erythromycin. So in pediatric patients with penicillin allergy, give erythromycin for 15 to 30 days. So you see, very important. If tetracycline, then give penicillin. If not penicillin, give erythromycin. So tetracycline, penicillin, erythromycin. So those are the three most important groups of medications we use to treat Lyme disease. And based on the severity of the manifestations, for example, if the patient has arthritis, you can give oral doxycycline or amoxicillin for 30 days for the initial treatment of Lyme arthritis. In patients who do not have concomitant neurological involvement. But among patients with arthritis who do not respond to oral antibiotics, then you need to give them IV antibiotics. The most commonly used one is IV ceftriaxone, Rocephin. And you're giving Rocephin like 28 days when the patient has neurological disease. So IV antibiotics, folks, are very important for the more complex manifestations of Lyme disease. And patients with neurological involvement are most commonly treated with IV ceftriaxone for 14 to 28 days. But you can also use ceftriaxone, IV penicillin G for the same duration. And in Europe, actually, they are using oral doxycycline and IV antibiotics in the treatment of acute neuroborreliosis, Lyme disease with neurological manifestations. So when they have atrioventricular block or PR interval more than 0.3 seconds, that means they have cardiac manifestations. Again, you need to use strong IV antibiotics whenever the heart or the multiple joints or the central nervous system is affected. So basically, folks, this is a disease caused by spider tick called Borrelia burgdorferi, and it goes around by the tick, and it is 3 stages, 1 to 3, and some patients develop facial neuropathy, and facial neuropathy can be like bilateral, it could be unilateral, and involvement is often asymmetric, and some patients present with a polyradiculopathy or multiple mononeuropathies. So let me summarize and I will finish. Lyme disease is caused by spirochetes and goes around through ticks, tick bite, stage 1, 2, 3. Stage 1 you see the rash, in stage 2 you see more systems involved, and in stage 3 it will be like brain and heart and other symptoms. The diagnosis is clinical most often, and there is high probability you just treat it without a diagnostic test. But whenever there is low probability, then you need to order some diagnostic tests. Treatment is tetracyclines, penicillins, and erythromycin. If the patient is just like an adult patient, you start with tetracycline. The patient is like a pediatric, a boy or girl, under 12 years old, you treat them with amoxicillin or penicillin 5. And if they are allergic to penicillins, then you use erythromycin. So those are the important things you need to remember in Lyme disease. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.